Are you ready to tackle the rising challenge of uterine cancer with cutting-edge AI technology? Discover how artificial intelligence is revolutionizing early diagnosis and personalized treatment to save lives. Uterus cancer, a modern challenge. Historically, cervical cancer or cervix cancer used to be the most common gynecological cancer. With the triumph of HPV vaccines over cervical cancer, uterine cancer now stands as the most prevalent gynecological cancer. In 2020, 417,000 women were diagnosed with uterine cancer, and alarmingly, cases among those under 40 have doubled in prevalence. Surprisingly, despite remarkable advances in treatment, failures in certain types of uterine cancers have increased by 2% between 1971 and 2014. This calls for better precautions. There is growing concern that modern lifestyle shifts, erratic dietary habits, and exposure to endocrine disrupting chemicals or EDCs and environmental pollutants are fueling the rise of more aggressive uterine cancers. In the past few decades, uterine cancer rates have surged by 132%. It is now a serious challenge for economically advanced nations. The Indian subcontinent is no exception, as lifestyle and dietary changes contribute to rising uterine cancer cases. The time has come to seek answers. How we can tackle uterine cancer more effectively. What is artificial intelligence? Artificial intelligence has arrived, changing the game in the medicine. A brilliant doctor's wisdom used to vanish with their demise. A skilled pathologist's keen eyes remain confined to their location city only. And a dedicated gynecological surgeon could only help patients they personally treat. But the world is evolving. The brightest minds, unstoppable, talented, and fiercely focused, are now teaching machines to think like them. Data scientists have joined the race, mining vast pools of information to detect diseases faster and deliver treatment more swiftly. Their goal? To reduce side effects, cut costs, and ensure patients not only survive, but thrive. Not just in New York's or London's top hospitals, but in remote villages of Purulia for Mrs. Orao, in Delhi for Mrs. Sunita Agarwal, and USA for Mrs. Smith. AI is offering them a chance at world-class medical care. And it does not stop there. AI is shaping the future for doctors like Manoj Chakrabarti, helping them redefine their treatments. Oncologists and chemotherapy specialists are using AI to choose targeted therapies that ensure their patients' long-term health. Let's step into this vibrant new era of treatment and see what's on the horizon. The current approach. Here is how uterine cancer treatment typically unfolds in New York or with up-to-date team of Kolkata. A patient experiences abnormal bleeding. If she recognizes it as unusual, she then visits a doctor. The doctor orders an ultrasound. If suspicions persist, a biopsy follows. Then comes the treatment. Surgery, sometimes accompanied by radiation or chemotherapy. But by the time all this happens, diagnosis is often delayed. Some patients put off seeing a doctor, perhaps because their daughter's wedding is approaching or they are off on a holiday to Vietnam. Even ultrasound reports may miss early stage uterine cancer, and for a significant number of women, the disease spreads silently without any symptoms. One day, they finally visit the doctor. So you learn, relying on symptoms alone is no longer an option. This conventional approach, waiting for patients to report symptoms, means early diagnosis is often missed. It's time to rethink the system. AI will diagnose diseases early. What's the solution? Now, imagine flipping the script. What if we could take seemingly healthy women and using a combination of body weight, genetic profile, ethnicity, tiny granular details from ultrasound reports, and family history of prostate, lungs, and uterine cancer, build a predictive model, a model capable of identifying their risks months or perhaps even years before symptoms appear. That way, treatment could begin before cancer even gets a chance to take hold. If you call it a prediction, then yes, it's a prediction. but not palm reading or mystical mumbo jumbo. This is science backed artificial intelligence at its best. A recent study in Turkey has caused quite the stir. It feels almost like stepping into a dream of future. If we can pinpoint cancer risk in advance, we could beat uterine cancer at minimum cost. No chemotherapy, no radiation, no radical surgery, all thanks to AI. In August 2023, Sabrina Piedimonte from University of Toronto shared research showing that artificial intelligence through neural networks, support vector machines, and other cutting-edge technologies could diagnose uterine cancer even before surgery. The flaws of traditional treatment, you must know this. Cancer treatment does not always follow a strict rule book. Gone are the days of simply treating based on staging of the cancer alone. At times, a patient with early stage uterine cancer completes the treatment, sighs in relief alongside their doctor, only for disease to return unexpectedly, more aggressive than before. On the other hand, some patients with advanced widespread uterine cancer, seemingly facing a grim prognosis, defy the odds, living on for years despite the expectations. These stories often get wrapped in myths of miracle cures and herbal remedies, but the truth is far more complex. Clearly, traditional methods don't always predict outcomes accurately. It is time to look beyond the old ways and embrace more precise, personalized approaches. AI is finding new trailblazing treatment clues. Those are hiding in the genes of our own body. The hunt for genetic clues started. The mystery behind unexpected cancer outcomes often lies in the tumor's genetic makeup. But don't assume genetic means it must be inherited. There is a difference between genetic cancer and hereditary cancer. What's clear is that almost every cancer stems from genetic faults that disrupt normal cell division, leading to uncontrolled cell growth, the very definition of cancer. For years, genetic puzzle of cancer remained unsolved. Now, the Cancer Genome Atlas program, or DCGA, has gifted us a staggering 2.5 petabytes of data, opening the doors to new frontiers in cancer treatment. Just how big is 2.5 petabytes of data? If a 32 GB pen drive holds 20,000 photos, 2.5 petabytes of data would store 1.25 billion images. No wonder cancer experts are left utterly astounded by the sheer scale of what's now possible. This breakthrough could change everything, reshaping how we understand and fight cancer at its core. The right medicine for the right cancer. Cancer has never been just one single disease. We have known that for decades. Take uterine cancer, for example. Under the microscope, the WHO identified more than 15 different types, each requiring a different approach to treatment. Why? So, doctors can tailor their care to the specific type of a patient is facing. But even with all these classifications, predicting how a patient will respond to treatment remains tricky. In 1983, Bookman introduced the dualistic model of uterine cancer, splitting it into two broad categories, one relatively mild and other aggressive. He expected his model will allow the doctors to recognize and treat two different varieties of uterine cancer. We have been following his model for decades. Yet, even at this model failed to fully capture the complexity of the disease, leaving scientists frustrated. But why? Treating uterine cancer based on how it appears under a microscope works for most patients. But for a significant number, the cancer refuses to play by the rules. Eventually, researchers realized that they needed more than just visuals. They needed immunohistochemistry, a technique that examines proteins within the cell to get to the root of the problem. Even that was not enough to satisfy the doctor's quest for answers. So, research delved deeper, right into genetic core of the disease. And here is where the Cancer Genome Atlas study stepped in, offering a game-changing boost to the search for most precise treatments. The future of cancer care is precision, not guesswork. With genetic insights leading the way, medicine is moving beyond guesswork and towards true personalized care. The future of cancer treatment is unfolding and it is looking sharper than ever. How much treatment is needed to a patient? With 2.5 petabytes of data mapping over 20,000 human genes, researchers uncovered even more subtypes of uterine cancer, all rooted in genetic defects. 53 abnormal. This aggressive type keeps making its comeback, no matter how early it is caught or how intensely it is treated. The takeaway? When this cancer appears, doctors must go all in, even if the intense treatment comes with tough side effects. Mismatch repair deficient. Even in its early stage, this type demands deep treatment or it risks returning stronger. In minority of the cases, she and her family may return with cancer of other organs. POLEmut. Unlike the others, this cancer, regardless of how far it has spread, rarely causes serious harm. Sometimes a cricket-loving husband insists that herbal remedies defeated wife's cancer. Sometimes we see, even in advanced cases of uterine cancer, the patient stays stable for a long time. These tumors' genetic makeup sometimes forgets to multiply. But beyond these three, there is another large group, NSMP, that is no specific molecular profile. This category lumps together patients who lack the genetic defects seen in the first three. Yet, even here, some patients do remarkably well, while others require aggressive treatment to stay better. The challenge of unrecognized but hostile uterine cancer. For years, doctors struggled to detect the aggression of such cancers without major invasive procedures, particularly if they presented with the cancer at an early stage. Traditional science would miss its threat, will not offer chemo, thinking it will not come back, but some will strike back in short time. So, can AI step to change the game? The hidden cancer. Amir Ali Darbanshari and his team took up the challenge. But here is the twist. He is not a doctor. He is a researcher from Department of Electrical and Computer Engineering at the University of British Columbia. They crunched the numbers and realized that while human eyes and mind can sense subtle differences in uterine cancer patients, pinpointing them accurately is far trickier. So they set out to train microscopes. They built a subtype prediction algorithm, a deep learning based image classifier designed to detect patterns in cancer cells that the human eyes simply misses. Through his work, they discovered a highly aggressive subtype within this NSMP group. Their research is now paving the way for tailored treatment for these patients. The name of this elusive subtype of uterine cancer? P53 abnormality like NSMP. And the true hero behind this discovery? Artificial intelligence, of course. Without AI, doctors would not even know these patients required a different treatment approach. The future of cancer care isn't just about seeing, it's about knowing. And AI is making that possible. From Japan to Toronto, a global revolution has started. Japan's Takahashi took a bold step inserting a camera into uterus to predict disease using deep machine learning. Meanwhile, in Taiwan, Chang developed a groundbreaking AI-powered neural network model to assess uterine cancer's risk via MRI without needing a radiologist. A crucial question haunts both doctors and patients before surgery. Has the cancer spread to the lymph node outside the uterus? Cancer experts worldwide are racing to answer one critical question. Is Mrs. Singh's uterine cancer affecting her lymph nodes or not? If this could be determined before surgery, for sure, she might still need the uterus removed, but she could avoid unnecessary lymph node removal, minimizing surgery risks. Current CT and MRI scans attempt to predict this cancer spread, but there is a major flaw. The lymph nodes can appear normal in size while secretly harboring cancer within them. That's when Chang dropped a bombshell. His enhanced MRI radiomics, powered by advanced AI models, could now determine pre-surgery whether lymph nodes were affected or not. Yes, before the surgery. Science is not just catching up, it is charging ahead. ensuring treatment decisions are sharper, safer, and smarter than ever before. Precision at its sharpest. What's truly remarkable is how AI models are diagnosing diseases with accuracy far beyond traditional methods. That's why gene prediction models come in. In just a few years, AI could predict a newborn girl's future risk of uterine cancer and even recommend the lifestyle adjustments from diet to exercise to help her avoid it. Wouldn't it be incredible if cancer could be detected with a simple blood test? AI is making that a reality too. Researchers in Preston, England, led by Maria Parashkavaiti, has developed AI-powered blood tests capable of detecting specific proteins linked to uterine cancer. AI is even guiding doctors on the best treatment, helping determine which chemotherapy works for whom and which targeted therapy offers the best chance of success. With the next generation AI just around the corner, we are inching closer to a future where medical breakthroughs are not just theoretical, they are practical, accessible, and life-saving. I think time ahead will be very exciting. That's all today. See you soon with another research article.